Hi, I'm Dr. Ahmed Abdelaziz. I'm a plastic surgeon. I am a Clarius KOL, and I'm talking today about facial assessment and vascular mapping using Clarius. I've been working with Clarius for the past 4 years. I've been using ultrasound more than this, and lately I have a lot of experience talking for Clarius and using ultrasound. So today I'm gonna be doing an assessment for the ultrasound for the face for my beautiful wife. She's my model today for assessment, and I hope she liked the result after we're done. And this is gonna be first assessment for different areas of the face. So I'm gonna start first I'm gonna record everything for you here. I'm going to start using the aesthetic upper face part, and this part we're gonna check first on the forehead. And checking on the forehead, now we see on the forehead here we can see the skin subcutaneous, the fat, and then the muscle. And the muscle, of course, that's the frontalis muscle and the periosteum at the end. So this is a very nice anatomy of the layers of the forehead. And if we go a little bit to the center here, if you can follow my probe, and I can show you exactly using the color Doppler where is the blood vessels. And I know this is the moment that we use ultrasound for. We need to know that's the supraorbital, and if I go to the center a little bit, we can see the supratrochlear as well. And using that area, I can see the corrugator muscle. So this is the supraorbital. We can see it at the end here, and the supraorbital here is midway, not very deep and not very superficial. It should be deep in that area, and if you can see here, this is not deep. This is going in the muscle part, and we can go here. That's the area we can see the corrugator now, and let's see the supratrochlear artery here. Now we can see the supratrochlear, that's here, that's the supratrochlear artery. And then we can follow them even if we go up, and we can see the depth. So they are more superficial, if you can see here how superficial they are. And usually they are very small vessels. If we want to follow up on them, we need to be very gentle, not to press on the probe. And if I go to the AI, I can see the AI depth of the vessel. So I made sure when it's deep, this is here, it's in the subcutaneous area, that's the blood vessel here in that part. So this is where it is. If you can see here, that's the subcutaneous part. Still a little bit deep. And if you go up, you can see it's changed a little bit superficial, but still subcutaneous. So let's go to the temple area now. And going to the temple is very, very nice for everyone, I'm sure. So first thing you see is a blood vessel, and this is the superficial temporal artery. And it is in the superficial fascia. I can confirm that. And then if I go a little bit down, now I can follow the artery. Can you see the artery here? Very nice. And the layers here is very obvious. You can see the layers and the muscle also as well. Can I ask you to press on your teeth, clench more, relax, do again, relax. Can you see the muscle contracting? Yes, perfect. So you can see the layers here, and the first layer you can see is the skin subcutaneous. Then if I can show you, that's the superficial fascia here, alright? And this part is underneath, that's the deep fascia, alright? The deep lamina with the deep fascia, and there is the superficial lamina on top of that, and there is the interfacial space in between. And this is the muscle here. I can show you where is the muscle. That's all that area is the muscle. All that part is the muscle. Alright, so now we're done with the temples. And let's go to the cheeks. And going to the cheeks is a bit tricky because the cheeks has a lot of structures. And First of all, that's the cheek, and this is how my probe is located. It's a little bit oblique, and it's the notch or the Clarius sign facing upward, and the other end facing downwards towards the commissure of the mouth. And we can see that the lowest part is the bone. The one above it is the zygomaticus major. Can you smile? Relax. Smile again. Relax. So you can see this is the muscle here in that part. And if I move with my device here, you can see the cheek fat. And let me show you, everyone. This is the cheek, the deep cheek fat compartment. It's here. This is the deep cheek fat compartment in that area, and on top of that is the SMAS layer. That's on top here. That's the SMAS. Alright, and there's the subcutaneous fat on top of that, and the skin. Alright, let's do a little bit of vascular mapping in the part. So usually I know that in that area, so what I can see here is the infraorbital. That's the infraorbital artery. So the artery is here, and it goes up until it reaches the superficial layer. So, and it comes from the foramen, which is here. How I know it's the foramen? I can see the discontinuation in the bone. So the foramen, here comes the artery, and we can see it. Now let's go up. And let's see, that's the bone, and this is the angular vein. See the angular vein? It is located in the tear trough part. So basically, this is where the angular vein is. See that part? That's it. And it's very critical to know that, because if you don't know, you go in, you inject in that vein, because this is the tear trough basically. And let's change how the probe is and be vertical with the probe. That's a coronal. It's a longitudinal approach. This is on the long axis, and you can see on top here, this is the globe, just on top, and going down, that's the deep fat in the middle and the bone. And we can see the muscle here. This is the aliquinase muscle, and it has that area, and this part, if we put down Doppler, what we see here, that should be the angular artery. I can play with the settings a little bit, the color, change the velocity, so now you can see the vessels. So now let's go for the pyriform space. So this is the pyriform space in the middle of the screen, and you can see the space. It looks like it's jet black. That's the area. So this is the space of the pyriform. She had never injected fillers in that area, so this is not fillers, because that's confusing for many people. And things that you don't know, usually just put the color Doppler. That's a rule. Anything you want to confirm, put the color on it. See blood vessels going in, and that's a blood vessel, which is the angular artery. And it's not deep, it's midway. That's it. Alright, so let's go to the area that I had a lot of questions on it, and this is the masseter. In the masseter area, you can go here, increase a little bit, and let's add a little bit of gel. So what I can see here is very nice view for you guys. So the first thing what we can see is this is the parotid, and this is all the parotid part, and see how homogeneous it is, and there is a continuation here on top of the muscle with the fascia. So this is all that is the parotid, and the muscle is here. That's the muscle part, and it extends all the way there. This is all muscle, and of course the bone underneath. And this is her masseter. That's very small masseter. See how small the masseter is? Can you press on your teeth? Relax. Press again. Relax. Okay, the masseter is moving and it has two lines, two septa, like the Y shape, and this is a very common configuration. And on top of that there is the parotid fascia or path, and there is the fat on top, there is the skin. And when I go just a little bit in front of the muscle here, what I can see, this is the facial, and if I put the color Doppler here, I can see, wow, that's the facial. So the facial artery is here, and then I can follow the facial artery. And the facial artery, we know it's a convoluted artery, so you can see just cut sections in it until it reaches the lips. And in the lips, you can see the superficial, or you can see the labial artery in that area. And that part, the white part at the end of the box, is the teeth. After that, this is the vestibule, which is the area under the mucosa. That's where the mucus is. Then the mucosa, and then this is the muscle, and it's deeper to the muscle, the artery here, and this is the muscle, and then there is the fibrofatty skin. So that's the lower lip now. Let's go to the lower lip. It was the upper lip before. This is the teeth, and let's see, this is the vessel. It's in here. So the vessel here is a little bit superficial on top of the muscle. And we can confirm that by the vertical position of the probe. You're gonna eat a little bit of the gel now. Easy. So this is the lips, the upper and lower lip. And we can see the vessel in the lower lip is superficial, has a superficial part here to the muscle. So I have to be very cautious if I want to inject her lower lip superficially, submucosal. That's a nice variation. And the lower and the upper lip, it's deep. So the lower lip is a bit risky to inject. That's a very nice image for the muscle, the curve of the muscle, the arteries, and everything. Alright, last thing is the chin. And the chin, it's a curved part in the chin, and being curved, it's very hard to see using the linear probe in that area, but you can see in that part here, this is the two belly of the muscle, and around it is the fibrofatty layer, and that's it. So this is two pieces of the muscle. I'm going to show it to you. That's one piece of the muscle, that's another piece of the muscle in here. So these are the two pieces of the muscle, and on top of that you can see the orbicularis, wrist muscle. Alright? It's the part of the lower lip in here, and that's the chin. Alright, so I think we're done with the assessment. The last thing is the mental foramen. We can see the mental artery coming in that area. That's it. So you can see it here, that's the mental artery coming through the mental foramen in that part. Alright, and of course this is the modiolus, and this is the DAO. That's it, this is the DAO, we can see it very obvious here. That's the spindle shaped part. And that's it. You can see the DAO in that area, and underneath is the inferioris component of the muscle. Sometimes on top we see the platysma. Alright, now we're done. You're gonna have a beautiful skin, and good job. So if you want to know more about aesthetics and medical information, you can follow my page.